Good evening, everyone. Once again, good evening. Welcome to this month's special edition of the Ask Mary and Pat Show, featuring Miss Mary Fenner and Miss Pat Boga. My name is Thomas Robertson. I'm sure you all know me by now, but I also go by Duke. I am the Technology and Metrics Director for Oak Hill Regional Community Development Corporation, which is the parent corporation of Healthy Kids Mississippi. We recognize our board chair, Jennifer Garrett, our executive director, Dr. Michael O'Miner, and our project director, Mrs. Lottie Miner. In addition to the Zoomcast, we are restreaming this evening's webinar on our Oak Hill Regional CDC and Healthy Kids Mississippi Facebook pages. Feel free to like and share on your own social media pages. Also, feel free to post questions or comments in the Zoom chat or in the social media comments. We will do our best to respond to each question, so we look forward to you guys' questions. A few announcements. Our next Ask Mary and Pat webinar will be August 29th, same time, same station. So if anyone would like to receive the Zoom invite for that, please add it in the comment section or the chat, and we will for sure get you the link to that. Um, Without prolonging the time any further, I'm going to turn it over to the stars of this show, Miss Pat Boga and Miss Mary Fenner. Ladies, you can take it away.
Good evening. Good evening.
Good evening, everyone.
This is Pat Boga, and of course, I'm an sister and navigator with Healthy Kids Mississippi, Get Cover Mississippi, and of course, we're delighted to be with you again on another edition of Ask Mary and Pat.
Good evening, everyone. My name is Mary Fenner, and I'm a Medicaid assister with Oak Hill Regional Development Corporation. And I would like to thank everyone for tuning in for Mary and Pat.
Okay, I guess we'll go ahead and get things started. We do have some questions already. And as Duke said, if you have questions, you can add them to the chat and we will do our best to answer them. And Mary, I'll start with the first question.
Okay.
Okay, it says, I have a 7-month-old baby and I'm having trouble finding formula for her. I keep hearing that it's okay to use formula from other countries. Is this true? Okay, and the answer is according to the HHS, and that is the United States Department of Health and Human Services, you may consider buying formula that is made outside the U.S. U.S. stores will start carrying or may already have started carrying infant formula from other countries. The Food and Drug Administration, FDA, has allowed these formula companies to market certain products in the United States and may allow more infant formula products that meet its criteria to be sold in the U.S. Make sure, though, that They are FDA approved of the formula, of course, and that you read the mixing instructions carefully for preparing powdered formulas. They may require different amounts of powder or water than formulas made in the United States. You may use the FDA's conversion chart to convert milliliters to fluid ounces, but otherwise it should be safe. Again, just make sure that it is FDA approved.
Okay. We have another question, and they're asking, what are my choices if my child has reached his 19th birthday month and his Medicaid will be closed? Okay, you may contact us at Get Covered Mississippi. That's 662-298-3584, and we will be able to assist you with enrolling your 19-year-old in the Affordable Health Care Insurance through healthcare.gov, or refer you to other programs that might be available for your 19-year-old.
I have another question. I had Mississippi Medicaid on my children and we moved to Arkansas. I stayed there for about 6 months, then moved back to Mississippi. I did not have my Mississippi Medicaid closed during this period of 6 months, but we did not use it while in Arkansas. Okay. I did not have Arkansas Medicaid either. And the question is, will I get in trouble for that? Okay. Now, I want to say this. Always remember to contact your Medicaid office if you have moved to or if you're planning to move to another state to have your case closed in Mississippi, okay? Make sure that you do that. Since you did not use the Mississippi Medicaid while in Arkansas, you should be okay. You must also contact Medicaid if you move to another address within your city or the state. This way, if you receive any correspondence from your Medicaid worker as far as renewals or just needing some updates, then you'll receive it. So just make sure that you update your address if you move, whether it's in the city or outside the state. And it won't result in your case being closed for not responding to an appointment, etc. But normally, if you have Mississippi Medicaid and you move to Arkansas and you use that Mississippi Medicaid there and you live there, you probably will be penalized. And Mary, can you do you have anything to add to that?
Yeah, because if you living in a different state and you're no longer a resident of Mississippi, you're not eligible for Mississippi Medicaid. So if you move somewhere, even if you haven't used it, you need to report that you have moved. Now, if you move back to Mississippi and your Medicaid has not been cut off, then you'll still have Medicaid, but make sure you contact your office to see if you missed any letters that they sent out for a renewal or for you to change your address or whatever, or appointments and things that you may have missed during that time. But you just need to contact them and ask them what is it that you need to do, and let them know that you did move, but now I'm back, and can I still use my Medicaid? Which you probably can if it hasn't been cut off, but you still need to contact them with any new information that you have.
And also, being a former employee of Division of Medicaid Mississippi, I've had experiences where there are some people, maybe a relative, so you have to be very careful and make sure you take care of your business, because there was a case where a relative contacted the Medicaid office and said, well, so and so has moved completely out of the state, and they did not close their Mississippi Medicaid. And so, if they can't reach you, and if someone reports that, I guess basically they may have to have some kind of proof, but you really have to be careful with that. But just make sure that you handle your business and get it closed before you move.
Right. Right. Because if any type of emergency came up and you had to go to the doctor in Arkansas, you wouldn't have anything, your child or yourself or would not be covered because you're now in Arkansas. So the best thing to do is follow proper procedure, let them know you're moving so they can take you off Mississippi Medicaid. When you get to Arkansas, apply for Arkansas Medicaid. And that will make sure that you are in the legal limits and that you have the coverage that you need for your health and your child's health. Okay, our next question. I received a letter from Medicaid stating that since my son is over the age of 19, he would no longer be eligible for Medicaid. But within 2 weeks, I received another letter stating that he has been approved for COVID Medicaid. Why did this occur? Well, according to the Department of Health and Human Services, which is the HHS, they determined that the disease presents a public health emergency. So many people in the United States would have lost their health insurance coverage through Medicaid for this very same reason. This public health emergency with PHE will allow parents and their children the opportunity to get the medical attention they need during the COVID pandemic. So that's why they extended the Medicaid.
Okay, well, there's a question. It says, when will I know if the public health emergency has ended so that I will have time to seek out other insurance coverage? Now, that's a very good question. You will receive a letter from Medicaid within 60 days of the end of the public health emergency, which should give you time to contact Get Covered Mississippi to get affordable health care insurance coverage. And of course, you can reach out to us and we will assist you in trying to, we'll assist you in enrolling in affordable health care insurance through healthcare.gov. But again, there should be a 60-day notice that the public health emergency is ending.
Okay.
And Mary, also with the constant rise of an uptick of different variants, that's what's been going on, for a little bit over a year now. Anyway, by the time we hear that everything is looking okay, then there comes another variant, and that's what's going on right now. I think it's the BA.5 variant, and it is very serious. So I'm thinking that this is the reason why it's been extended a few more months to October 31st. Right.
Right. Yeah, it's been extended out to at least October 31st because of the different variants that we have and the uptick of people actually getting COVID. So, okay. What are some reasons for denial or closure of children's or families Medicaid in Mississippi? But some reasons for being denied or closure would be your family income exceeds the maximum allowed, your child has aged out, you did not submit requested documents within the time period of the application process, you received family coverage due to low income and your oldest child turned 18. Your Medicaid as a parent will end after that child is 18. That 18-year-old will continue to receive Medicaid until they're 19 years old. Yeah. So once your child turns 18, the parent is no longer eligible for Medicaid. Not unless you're pregnant, that type of thing. Other than
That's
that,
right.
if you're pregnant, yes, you can still have it, but if not, then no.
We do have another question. We will take a commercial break at this time, and we will be right back.
Congratulations! You have successfully selected and enrolled in a marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
And I do see that we have another question, but right before we go to that question, I do want to emphasize, or we want to emphasize back to school health coverage, immunizations, and also coming up in August. August will be Breastfeeding Awareness Month. So we will be providing some information during the month of August on that, and also baby formula shortage. And of course, reminding you again that the shelves are still low, but be sure to visit hhs.gov/formula for any updates. And as we learned before, it says you can try a new brand, you can breastfeed, you can try formulas that are made in another country, and but make sure that you talk to your pediatrician or your family doctor, and they may be able to assist you. And also, they have some of Facebook groups, and just make sure that they're trusted sites, and they can assist you with finding a formula for your baby. And there's a question. I have not had to renew my children's Medicaid in over a year, but my sister lives in the next county in Mississippi, and she said she has had to renew her children's Medicaid each year. Why is this? Well, some offices are completing annual renewals and some are not. It is at the discretion of each individual office, but it is important that you contact your Medicaid worker or Medicaid with this concern, because they can let you know exactly what's going on. Mary, do you have anything on that?
Yeah, that's true. It depends on the Medicaid office, what that office, if it's a large office that has a large caseload, they may not renew every year. But if it's one of those smaller offices in one of the smaller counties, they may, because they can do it and it's not affecting their caseload. So it depends on the office and how many cases they have. It depends on their caseload. We'll decide if they're going to renew your Medicaid or if they're going to let it roll over. But the best thing is to do, if you can, contact your Medicaid worker and talk to your worker and just ask questions about what's going on, or do I need to renew? Do you have my new address? Do you have my correct address? Make sure they do have your correct address, your correct phone number, because if they don't, they may have sent a letter out. And if you have not had to take your child to the doctor and all of a sudden you go and your Medicaid is cut off because they don't have your correct address. So it's best to contact your worker and let them know that, just check with them and see what address do you have for me? What phone number do you have, just in case. Don't be afraid. Contact your worker. As Patty said earlier, handle your business.
Okay. See that
There's a question in the chat.
yeah.
It said, does each Medicaid recipient have a dedicated caseworker that they are to contact? And yes, each Medicaid client has a Pacific Medicaid worker that you have been assigned to. So you need to call the office and find out who your Medicaid worker is. And they'll let you know who the worker is, and they'll transfer you to their phone. And you can leave a message, or the person might be able to pick up and talk to you right then and there. But if you don't know your caseworker, you need to call and try to find out who your caseworker is.
And I will say this too: you are assigned to a worker. Now, if you call the office, oftentimes we experience this as well. some people they may have had an issue with their caseworker or with their Medicaid specialist, and they will call and ask for another worker, you know, that think they may know and that can help them and will go ahead and push their case through. But you have an assigned worker. That person works that case unless the supervisor, you know, ask another worker to work it. But you do have an assigned caseworker.
Yes, and more than likely, that caseworker is going to be the one that has to work your case. So if you have any questions, you do need to call that caseworker and talk to that particular caseworker.
Okay. You have another question? My daughter turned 19 3 months ago, and we both are still receiving Medicaid due to the public health emergency. My Medicaid worker told me that the public health emergency was extended through July 2022. Will it be extended any longer because we just contracted the new COVID variant, BA.5? Okay, and that answer is yes. We just received notification, I believe a week ago, that the public health emergency has been extended to through October 31st of this year. So it has been extended. So you're pretty safe right now.
Okay, we have another question. I was approved last year for pregnancy Medicaid, and my baby will be 1 in 2 months. He has received Medicaid since birth. What do I do when my baby turns a year old? Well, you should receive a renewal letter from the Office Division of Medicaid for you to fill out soon. You should have received it already because usually they send them out, 2 or 3 months in advance. So if you haven't received it, you may need to contact the office and ask to speak to your worker, or you can contact us, the Medicaid assisters, and we can help you with your renewal by actually putting in the application for you. Make sure you have your birth certificate, Social Security card number for the baby, and they really need the Social Security number for the baby. They have proof of the birth already because you were on Medicaid when you had the baby. So, but you do need to have that Social Security number to give to the office so that they can renew the Medicaid.
There's a question in the chat. How do recipients get reimbursed for doctors' payments that they made before they were approved? Now, when you apply for, okay, it has to be within that month, unless when you applied for Medicaid, you applied for retroactive Medicaid. Medicaid can go back at least 3 months. Now, if you applied for retroactive Medicaid, all you have to do is just make sure that you contact the physician or the facility that you went to and let them know that you have been approved, and they can submit documents for payment. But this will have to be sent in to Medicaid.
Right. Yeah, you need to let them know that. So whenever they submit for payment, they can submit the date that you were seen so that you can get reimbursed for any expenses that you have, including medication as well. But if you have bought medication, you also need to call the main 800 number for Medicaid, the main office in Jackson, and let them know that you have expenses that you apply for retro Medicaid and that you have expenses that you occurred before you got approved for Medicaid, but you got approved for the retro Medicaid. And you can contact them. I think their number is 800-421-2408, and let them know that you do have expenses, and they may ask you to send in the receipt. So whatever receipt you have, make sure you keep them so that you can get reimbursed. Okay. Does Medicaid cover back to school physicals? Yes, Medicaid does. Medicaid beneficiaries are encouraged to get a free annual health screening from your doctor or clinic yearly. And this annual physical does not count toward the number of Medicaid visits that you are allowed each year. You are allowed a limited number of hospital, or not necessarily hospital, but doctor visits. And so this annual visit would not be counted toward those allowed visits that you have. Also, if you have like a chronic medical situation that you have to go to a doctor quite a bit, and it might bring you over your allotted Medicaid hospital doctor's visit, what you need to do is let your doctor know so they can contact Medicaid so they can extend your visits, because there are cases where people have to go more than the allotted amount of visits. So if that's the case, you let your doctor know that they need to contact Medicaid, and let Medicaid know that you need additional visits. Also, office visits, it includes the office visits, the family planning services, inpatient hospital care, outpatient hospital care, prescription drugs, eyeglasses, and mental health care. Those are the things that are covered by Medicaid, so that you would be able to know those are the things that you can get from Medicaid, what their services are. Also, dental care. You get dental care as well.
Okay. Well, I believe we'll take another commercial break before we go to the next question. And again, we just want to thank each and every one of you for joining us on this month's edition of Ask Mary and Pat. We'll take a commercial break.
There are Mississippians applying for health insurance that may not qualify for a program. However, we all know it is important for families to have health insurance. This is why Healthy Kids Mississippi has been working with our state's federally qualified community health centers, or FQCHC, to help our fellow citizens find a medical home. Our organization is focused on raising public awareness about health coverage options for children and their parents through the Medicaid and Children's Health Insurance Program, or CHIP, in the state of Mississippi. Our process is simple. Our organization's assisters seek out Mississippians. Once our assisters gather the necessary information from the consumer, they apply for insurance programs on behalf of them when consent is given. When the application process is complete, the applicant will find out by mail if their application has been approved. We want to help as many families in Mississippi as we can. To learn more about our organization, please visit us on our website, healthykidsms.org, or give us a call at 662-298-3584. We welcome you.
Okay. Thank you. I have a question. What are the requirements for my children to be eligible for Mississippi Medicaid? And I'm assuming this is a first-time applicant. Okay. You must be a United States citizen or a qualified alien. You must reside in Mississippi. Your children must meet the age requirements, and you must meet the income requirements. You must file a Medicaid application form, and you must also provide requested verifications within the allowed time limits. Now, during the application process, again, not if you don't it's normally a 30-day processing period, and if you don't get your requested verifications, your documents in within that allowed time, you will be denied.
Okay. We have a question from our Facebook page. And the question is there any program available under the Medicaid umbrella that will allow a school-age child to qualify without a parent? And there are instances where a child can qualify for Medicaid without a parent. It depends on the situation. If they're no longer with that parent, that would be one case. And there's a guardian in the situation, then the guardian's income doesn't count toward that child to be eligible for Medicaid. Also, foster care children are eligible for Medicaid without a parent. Then you have children that have been no longer, they may be in the household with the parent, but they're no longer under the parent's care. Also, you have children that have become independent from their parents. It's a case that they no longer, their parent is no longer responsible for them, then they're eligible for Medicaid without their parents' consent. So there are instances, and if that's the case or a situation where a child needs Medicaid, they need to contact the Medicaid office or contact the office in Jackson and let them know that, or either maybe if they can go to someone and let them know, or talk to the Medicaid person, then they may not know that they're eligible for that. Maybe there's an adult around that can help them with the situation, but they do need to contact the Medicaid office to see if there's any program that they can be put into without their parent. And it is some out there. There's some out there where they can be eligible without the parent.
Okay. I do want to emphasize we have a back to school to-do list. And on this list, we have enroll in Medicaid or CHIP, schedule well child visit, catch up on care, and get vaccinated. Okay? And it's never too early to start thinking about the new school year, which is right around the corner, actually. So make sure that Medicaid and CHIP does cover vaccines, eye exams, dental visits, and other care kids may need to participate in classroom and after school activities. And we would love to help you. So please let us help you find coverage. Give us a call at 662-298-3584 or text 662-689-9712 for more information. Okay.
There's another question. Are there any limitations as to the medical professionals who take Medicaid payments? As far as I know, there are none. There's nothing that you cannot get treated for that's not covered by Medicaid. Medicaid covers a large range of things. And it's just like if you have regular insurance. So if you think about regular insurance, what's covered under regular insurance is the same way for Medicaid. It's the same. It's just that the state are paying your payments instead of you coming out your pocket with the payments. But it's just like regular insurance. Whatever you're being treated for, it should be covered.
I have a question here. Can you assist me with applying for Medicaid for myself or for my family and I? And yes, we both can as sisters. We can also assist you with enrolling in affordable health care insurance as an assister and a navigator.
And also, if you're not eligible for Medicaid and if you're not eligible for the HCA program, we do have the federal not marketplace, the federal, help me, Pat, qualified, right. We have that
health centers.
Right, the federal qualified health centers that we can refer you to for, and they'd be able to help. The payments are according to your income. It's on a slide payment that you will have to come out of your pocket with something, but it may not be as if you're going to a regular doctor. So you can, we can refer you to one of those. We have a person that works with us that's real familiar with that program that we can refer you to her, and she'll be able to assist you with any type of medical assistance you may need.
A question in the chat. I have active Medicaid. Can I be denied treatment due to a previous balance owed before I became eligible for Medicaid? Okay, now that is going to be a question. I mean, I have active Medicaid now. Can I be denied treatment due to a previous balance owed before I became eligible? Now, that's really going to be up to the physician that you go to. You know, if you did not have Medicaid if you did not have active Medicaid at the time that you owed those previous balances. So that part, that's really going to be up to the physician. Now, if you went, or if these balances are within the 3-month period of your retroactive coverage, you may be able to go back to the Medicaid worker and see if they can go back and pick up those 3 months if it's within that period. For instance, if you were approved in June, okay, and if you go to your Medicaid worker and ask, and if that balance was owed during that time or acquired, if you went to the doctor and received those services during that time and owed a balance, go to your Medicaid worker and see if they can go back and pick up and do the retroactive coverage for those 3 months. But otherwise, it's really going to be up to the physician or the facility that you went to if you went before you had active Medicaid. Okay, are there any more questions? Don't see any more. But we do, again, appreciate you for joining us this evening for Ask Mary and Pat. And I don't have the exact date for August, but it is usually the last Monday of each month, 6:00 p.m. We'll be back. And of course, if you have questions that you you may want to ask, well, you can go ahead and submit them. You can submit them in advance. You don't have to wait until we come on live, okay? So again, we want to thank, okay, it's August the 29th. Okay, that will be our next Ask Mary and Pat. Okay, thank you. Thank you. And again, we just want to remind you that if you're not approved for Medicaid or CHIP and or affordable health care insurance, we do have the federally qualified community health centers services available. And of course, there's normally a federally qualified community health center in your area within the state of Mississippi. And you can contact our office. You can contact Mrs. Bettina Campbell, and she can help you with those services. Okay. This has been a production of Oak Hill Regional Community Development Corporation, belonging, building, and bridging in the Mid-South region and across the state of Mississippi. Again, we thank you for joining us. And Mary, do you have anything additional to add?
No, I don't have anything additional. I would like to thank everyone as well for joining us. And we look forward for you coming back on August the 29th.